Hello, 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 hello. How is everyone doing out there today? It is Sunday, April 1st. It's Easter Sunday. So happy Easter to everyone. It is 3:08 p.m. and you know what time it is. It's time for Talk with the Doc. I know it's a holiday and everybody's like, "Doc, how are you going to do your show on Easter?" Listen, Doc doesn't take a break. Y'all guys need the information. Hey, Miss Cora, thanks so much for watching. Please share this video. You guys need the information and Doc is here to share it with you. Rain or shine, holiday, it doesn't matter. I'm going to give you this information so that you guys can all learn what you need to learn, right? So like I said, it is Easter Sunday. Now, it is April 1st, but today we are not going to be fooled. We are not going to be fools. We are going to get this information and we are going to learn this information. It's going to be short and quick because I got to go spend time with my family because that's what I love to do on holidays. And I'm so glad that they moved down here to the South to be with me. And so I'm going to go spend the day with them. So it's just going to be a short talk with the doc today, but I do want to give you this information. So like I said, it is April 1st. It is Easter Sunday, also known as the Resurrection Day. For my evangelicals out there, we celebrate resurrection, the resurrection of Jesus Christ, our Lord and Savior, and we are so glad that even though he died on the cross for our sins, for our transgressions, that he rose 3 days later. And so today on Talk with the Doc, I want to talk about rising. There was a great song by Miss Yolanda Adams, and I do not own the rights to this song, and I need to add that to my post, but it was something like, "Yet still I rise, never to give up, never to give in against all odds. Yet still I rise, high above the clouds. At times I feel low, but still I rise." And that's what I want to talk to you today about, guys, is rising. How do you rise despite having a chronic disease? How do you rise above having a chronic disease? It is hard to live with chronic disease, guys. It can be discouraging. It can be hard. It can hurt. Chronic disease is not easy, and it's not easy to live with. Listen, guys, take it from someone who has chronic disease. Take it from a doctor who treats chronic disease. Knowing about chronic disease, it's not easy. Hey, Superior, thanks so much for joining in. I appreciate you watching today. Oh, I didn't introduce myself. Let me introduce myself for those of you who don't know who I am. Hey, Miss Sylvia, thank you so much, and thank you for telling me I sound wonderful. Thank you. Some people say keep your day job, Doc, but I do like to sing a little bit. I do like to sing. But who am I? I am Dr. Nicole, your board-certified family medicine physician. I specialize in managing, treating, and preventing chronic medical conditions and explaining those conditions to everyday people in terms that they can understand. Through my books, my seminars, and my concierge medical practice, I help pastors and congregations, busy professionals, folks who are overworked, overwhelmed, and overweight, transform their mind, body, and spirit so that they can have a greater impact on the world around them. That is their children, their congregations, their communities, everyone around them. So what I'd like you to do today, I want you to share this video. That's one thing I need to ask you to do. And the second thing I want to ask you to do is to go out and get a copy of my book. Guess what, guys? My book is out. Yay! I have physical copies in hand. So those of you that ordered a copy of the book, it will be shipped out to you this week. I finally have the physical copy, so the book will be shipped out to you this week. The 12 Secrets, I have it upside down. Lord have mercy. The 12 Secrets of Divine Health, it will be shipped out to you this week. And for those of you that want to get a copy, you can go to www.divinehealthbook.com, and I'll put that link in the comments, divinehealthbook.com, and you can learn all of the secrets to divine health. So what I want to talk to you today just briefly about is how you can rise in spite of chronic disease. It's Resurrection Sunday, right? So we want to rise. Just like Christ rose from the dead, we want to rise above chronic disease, all right? So first things first, it's going to be 7 tips on how to rise above chronic disease, how to rise in spite of chronic disease. I know it can be debilitating. I know it can be hard. I know it can be rough. I know it hurts sometimes. I know it's like, oh my God, I got to take more medicine. I got to take better care of myself. I got to do all this stuff when I find out I got a disease. When you find out you have a chronic disease, it can be a bit taken aback sometimes. It can kind of push you back. But I don't want you to go backwards. I don't want you to take 2 steps forward and 3 steps back when you find out you have a chronic disease. I want you to keep pushing, keep moving forward, all right? So 7 tips on how to rise above chronic disease on this Resurrection Sunday. Tip number 1. You want to get all the information that you can get about the disease. You guys would be surprised about how many people come into my office that have things like diabetes or high blood pressure or high cholesterol, and they don't really understand it. They don't really know about what diabetes is. They don't know what their diagnosis is. I have a lot of people who come in my office and another doctor maybe gave them a diagnosis and they don't even know the name of the diagnosis. They're taking medicines, they're doing stuff, they're going to see specialists, and they don't even know what they have. So first things first, guys, get information about the disease. And don't just get the name. Don't just get the name of the medicines. Get all the information that you can. Meet with your doctor. Find out. Ask them to give you the ins and outs of the disease. How do you live with the disease? How do you improve the disease? Is this a lifelong disease? Is this something that you can get off of the medications one day? Is it something that you, what's the prognosis of the disease? Is it life-altering? Most diseases are, but you've got to know all the information that you can about disease. Now listen, guys, I did want to tell you the difference between disease and illness. Excuse me. Disease and illness, they sound the same, but they are 2 different things. A disease is a process, a pathological process. That means it's some kind of something that you go through, something that you're diagnosed with. It involves some sort of abnormality. So you've got an abnormal blood pressure, an abnormal blood sugar, an abnormality like a lesion on the brain. You've got some kind of abnormality in your body, all right? That is the disease. Now, the illness is more of how you deal with and your perception of that disease, okay? So the illness it's more of a psychological. It's the thought process that goes behind it. It's how you deal with that disease, that changes that you have to your body. All right, the changes that you have to your body, and that's what the difference is between illness and disease. So you've got to know the difference. You've got to know all about the disease process that you have and how to deal with it. All right. Tip number 2: see your doctor regularly. I can't stress this enough. See your doctor regularly. That doesn't mean once a year. Okay, especially if you have chronic disease, sometimes you need to be seen on a quarterly basis, so every 3 months. Sometimes it's every 6 months, depending on how well controlled you are with something. Sometimes it's when you're getting started on a new medicine, maybe the doctor wants to see you back weekly or every 2 weeks. But you need to see the doctor regularly. You need to find out from your doctor, how often do I need to be seen, doc? How often? All right. So, number 1, you're going to get information. Number 2, you're going to see your doctor regularly. Number 3, and I can't stress this one enough, take your medicine. Take your medicine. Take your medicine. Take your medicine. Let me say it one more time. Take your medicine, all right? I know it can be a little bit daunting. You're like, oh my gosh, I got diagnosed with, let's give diabetes, for example. Not only do they have me on a pill to bring down my sugar, but they have me on a pill to protect my kidneys. Then they got a pill to bring down my cholesterol. Then they got me on an aspirin to lower my blood, the thickness of the blood. So all of a sudden I got this diagnosis and now I'm on 4 pills. Why? It's important. I promise you it's important. And you need those medications to help initially to manage the disease. Now, you should be working with your doctor to hopefully get off of those medications and see what medications you can get off of. But at the beginning and while you're being treated actively, you need to be taking your medications as prescribed. So don't take more. Okay, don't take less. If you feel like something's wrong with the dose, go see your doctor before you change it up on your own, all right? And don't take somebody else's medicine, all right? Oh, mama had the same diagnosis, so I'm just going to take what she has. No. Don't do that. You need to take your medicine at the way it's prescribed, and before you make any changes, go see your doctor. But also at the same time, you want to talk with your doctor about, doc, how can I get off of these medicines? Yeah, I'm on 12 medicines, I'm on 12 pills, but I want to get off of some. How do I do that, doc? What do I need to change in my life to be able to get off of some of these medicines? And your doctor will go through that with you, all right? So, number 1, you're going to get all the information you can. Number 2, you're going to see your doctor regularly. Number 3, you're going to take your medicine as it's prescribed. Number 4, modify your diet. Modify your diet. You know doc is going to come at you about some stuff about the diet, right? Because it's all about the diet. There are some disease processes that can be changed completely with what you're eating. Did you know that? People that have, for example, PCOS, did you know that by eating certain things in the diet, things like gluten, things like artificial sweeteners and artificial things in the diet, it can worsen things like PCOS. People that have neurologic problems like seizures or MS, multiple sclerosis, or anything neurologic. Hey, doc, thanks so much for watching. When you take things like artificial sweeteners, aspartame, and things that have artificial sweeteners in it, things like Diet Cokes, things like the Crystal Lights, that stuff can actually flare up and cause problems with the neurological system. So you've got to watch your diet. When you have a chronic disease, you've got to modify your diet. If you have diabetes, you've got to change up how many carbs you're eating and how you're eating, what times you're eating and how you're eating. You don't want your sugars to go up too high. You don't want them to drop too low. So you've got to modify your diet. Of course, doc is always going to tell you if it grows from the ground, it grows as a plant, I want you to eat it. If it's made in a plant, I don't want you to eat it, right? I want you to limit that. So limit the artificial things, and that way you can modify your diet to take care of and to help manage your chronic disease. Modify your diet, guys. And if you need some help on that, find some help. See a nutritionist. See your doctor. Ask, doc, what things do I need to avoid in my diet? For instance, if you're on something like Coumadin, you need to avoid some of the green leafy vegetables because that increases the vitamin K and that can throw off your Coumadin levels. So these are things that you need to discuss with your doctor at those regular appointments, right? With how do I modify my diet to better take care of and better manage my chronic disease. All right, number 1, we're going to get information. Number 2, you're going to see your doctor regularly. Number 3, you're going to take your medicine as it's prescribed. Number 4, you're going to modify your diet. Guess what number 5 is? Y'all know number 5 is my favorite, right? Number 5, you're going to increase your exercise. Increase your exercise. Listen, I cannot stress enough how important exercise is to manage chronic disease, all right? Things like cardiovascular disease, things like endocrinology and endocrine disorders, things like neurologic disorders, things like even problems with the skin. All of this can be improved by increasing your exercise. I did a talk a little bit earlier today. I was talking about the story I heard on the news with Arnold Schwarzenegger, who had emergency open heart surgery. He was actually getting a routine valve replacement, and they turned into an open heart surgery procedure. And the first thing Arnold said when he woke up, according to the news report, was, "I'm back." And I talked about this morning in my live post this morning about the importance of cardiac rehab after open heart surgery. So if you have anything cardiac going on, high blood pressure, high cholesterol, coronary artery disease, peripheral vascular disease, peripheral arterial disease. If you've got anything going on with the heart, you need to be exercising. How can you do that? By going to cardiac rehab. It is so important to get that cardiac rehab. That's how you're going to increase your cardiovascular supply. That's how you're going to maintain your cardiovascular output, and you're going to improve it, right? Because it's so important. You guys got to exercise. Sometimes that exercise needs to be monitored, all right? That's why cardiac rehab is so important, especially when you've had open heart surgery or when you've had anything going on with the heart, is because you're monitored while they're exercising, okay? So they're watching your heart rate, they're watching your blood pressure, they're watching your respirations, they're watching to make sure that everything is okay with your heart while you're exercising. Sometimes, though, if you've got something like a knee problem or a joint problem, you need to be working out with a trainer, okay, so that they can watch and make sure that you're not hyperextending the knee when you're doing a squat or a lunge, or make sure that you're not hyperextending an elbow or a shoulder when you're doing the exercise. So physical therapy, cardiac rehab, cardiovascular exercise with the trainer, all of these things are so important when you have chronic disease. But even if you can't do something specific, I just want you to get out there and walk. All right, I love what my trainer, Master Tracy Goodwin, says. He says, give me what you got, and what you don't got, you can keep, right? So give me what you got. You got to get out there. Even if you can only walk from here to the mailbox, give me what you got, all right? Then take a break, take a rest, and then walk back, okay? But then the next day, walk a little bit further. Hey, Miss Wakita, thanks so much for joining me. Please share this video. Happy Easter to you. So you got to exercise. You got to exercise. All right. So that's number 1, get information. Number 2, see your doctor regularly. Number 3, take your medicine as prescribed. Number 4, modify your diet. Number 5, increase your exercise. And number 6, mind your mental health. Guys, I tell you all the time that we are one body, but we're made of 3 parts: mind, body, and spirit. So you've got to mind your mental health. When you have a chronic disease, I'm telling you, it affects your mind. I promise you it affects your mind. When you can't do like you used to do, when you are hurting sometimes, when you've got to take a whole bunch of medicine, when you're trying to figure out how am I going to pay for this surgery, how am I going to pay for all this medication, how do I just deal with this new changes in my body, I'm telling you, it can take a toll on your mind and on your mental health. Sometimes people get depression. They get anxiety, they get insomnia, or the inability to fall asleep like they should, and it affects your mind. Things like fibromyalgia and chronic pain, we often treat concurrently. That means at the same time we treat depression, because it's not uncommon for people that have chronic pain to also have depression, because like I said, pain sucks. It really does. And it changes who you are. All right. So we have to mind our mental health as well as minding our physical health. So don't neglect your mental health, guys. Attend to your mental health. All right. Make sure that you are doing your mindfulness. Make sure that you are sleeping okay. Make sure that you're getting enough sleep, because that will also help with your disease process. All right. So you've got to mind your mental health. And if you find that you're not sleeping, if you find that you're depressed, if you find that you're anxious, go and get some help. Please go and get some help. See your primary doctor, see a psychologist, see a psychiatrist, see a therapist, see your pastor, see someone who you can talk some ideas off of, so that you can improve your mental health. All right. One more, guys, and then we're going to be done. Number 1, get information. Number 2, see your doctor regularly. Number 3, take your medicine. Number 4, modify your diet. Number 5, increase your exercise. Number 6, mind your mental health. And number 7, and I love this one, I say you need to acknowledge that you have a chronic disease. Acknowledge it. You'd be surprised how many people come into my office and say, I don't have diabetes. I don't have high blood pressure. And I understand that we don't want to give it a name. We don't want to call it out. We don't want to, as we say, call things that are not as though they are. I understand that. And especially when I'm dealing with my evangelicals and my Christians, and I understand we say, we're the healed of the Lord's, and so we're not going to claim anything, but I still need you to acknowledge it, because if you don't acknowledge it, then you won't address it. All right. So you've got to acknowledge the disease. Guess what else acknowledging it does? Acknowledging it means I know I have it, but it means I don't have to live with it. Right? You do have to acknowledge it in order to treat it. All right. So I want you to acknowledge the disease, but at the same time that you're acknowledging it, I don't want you to own it. You'd be surprised how many times I hear people say, my sugar, my MS, my seizures, my this, my that, my lupus, my chronic pain, don't own that diagnosis, guys. It is not who you are. You might have the disease, but the disease does not have you. You don't have to own it. You don't have to walk in it every day. All right. We are challenged every day. We overcome every day. And that makes you a chronic illness warrior. All right. And what I want to say is that, hold on, because it was a great quote that I found today, and I loved what it said. You gain strength, courage, and confidence by every experience in which you really stop to look fear in the face. You must do the thing which you think you cannot do. All right. So, guys, I don't want you to own your disease. I know that we're the healed of the Lord's, and I know that by his stripes we are healed. And I know that. I know it. But first of all, you need to acknowledge the disease, but don't own it. All right. You are not your disease. All right. You are not your disease. There is so much more to you than the chronic disease that you may have in your body. And I want to encourage you today to not use it as a crutch, all right, but use it as a stepping stone. Use it to rise up. Use it to overcome. Use it so that you can resurrect on this resurrection day and find someone to help you. Find someone to rise with you, all right? Rise, rise, rise. That's what we're talking about today on this resurrection day, how to rise above chronic disease. So those are the 7 tips. Let me give them to you one more time. Number 1, get information. Number 2, see your doctor regularly. Number 3, take your medicine. Number 4, 4, modify your diet. Number 5, increase your exercise. Number 6, mind your mental health. And number 7, acknowledge the disease, but don't own it. All right. Thank you so much, guys, for joining me today on Talk with the Doc. You know I'm here every Sunday at 3 p.m. Eastern Standard Time, and we talk face to face. Okay. Thank you all for joining me today. You all know who I am. I'm Dr. Nicole, your board-certified family medicine physician. I specialize in managing, treating, and preventing chronic medical conditions and explaining those conditions in terms that everyday people can understand. Hey, Miss Marsha, thanks for joining in. Watch this video, share it with your friends. I promise you it'll bless your life. Listen, through my books, my seminars, and my concierge medical practice, I help pastors, congregations, and busy professionals, folks who are overworked, overwhelmed, and overweight, transform their mind, their body, and their spirit so that they can have a greater impact on the world around them, their children, their congregations, and their communities. Thank you so much for joining me. Please join me every Sunday at 3 p.m. Eastern Standard Time for Talk with the Doc. Listen, all the tips that I gave you today, we talk about all of these things in my book, The 12 Secrets of Divine Health. Look, guys, I actually have the book in hand. Woohoo! I have the book in hand. So if you ordered your copy, you'll be receiving it this week, all right? Your autographed copy. I'm working hard signing them, and I'm going to send them out this week. So please wait just a couple more days, and you're going to get your book. Thank you so much for ordering. And if you want to order an autographed copy, you can go to www.divinehealthbook.com. That's divinehealthbook.com, and you can get your autographed copy of the 12 Secrets of Divine Health. Everything we talked about today on how to rise above chronic disease is discussed in this book, The 12 Secrets of Divine